Welcome back to the Pro PA podcast. I'm your host, Prof G, and today we'll be discussing something that affects nearly every patient we see: heart health. February is Heart Health Awareness Month, making it the perfect time to revisit key cardiovascular screening and prevention guidelines that all PA students and practicing PAs should keep in mind. Did you know that the very first heart attack ever diagnosed was nearly missed? In 1912, Dr. James Herrick, a Chicago physician, made a groundbreaking discovery. Before his research, heart attacks, or what we now call myocardial infarctions, were thought to be rare or instantly fatal. But Dr. Herrick's work proved that patients could survive heart attacks if initially diagnosed early, and even more importantly, that they could be prevented with the right lifestyle changes and medical interventions. Fast forward to today, and heart disease remains the number one cause of death in the US, taking a life every 33 seconds. Despite all of our medical advances, prevention remains our strongest tool. That's why this month serves as a reminder to prioritize cardiovascular screening and prevention in every patient that we see. In this episode, we'll cover cardiovascular risk factors, who needs screening and when, guidelines for hypertension, hyperlipidemia, diabetes, and coronary artery disease prevention, and how we can encourage patients to take control of their heart health. Whether you're prepping for the PANCE, PANRE, or actively treating patients, these reminders could save lives. Let's get started. First, let's look at the importance of cardiovascular screening. Why does heart disease deserve its own awareness month? Well, heart disease is the number one cause of death in the US, responsible for nearly 1 in 5 deaths annually. That's pretty striking. And many of these cases could have been prevented through early screening, lifestyle changes, and proper medical management. As PAs, we play a crucial role in identifying risk, counseling patients, and initiating treatments that can save lives. So let's go over who should be screened, what to look for, and how to intervene. To effectively prevent heart disease, we need to assess the major risk factors. I like to call them the big five. Number one, hypertension, which is what I like to call a silent killer. Number two, hyperlipidemia, the clogger of all arteries. Number three, diabetes, a major accelerator of atherosclerosis. Number four, smoking, a direct contributor to vascular damage. And number five, obesity and sedentary lifestyle, which are also hidden dangers. Each of these increases the patient's risk for heart disease, but when combined, the risk skyrockets. Guidelines for cardiovascular screening. Now let's break down by category and review the most up-to-date guidelines on what we should be screening for. Let's start with hypertension screening. So the USPSTF recommends that an annual blood pressure screening be done for adults 40 years and up, or for those that have any risk factors. Every 3 to 5 years for adults 18 to 39 with normal blood pressure and no risk factors. So, what to do in clinic? If we find a blood pressure that's greater than 130/80, confirm it with home monitoring or ambulatory blood pressure readings. Consider lifestyle modifications, first line medications like ACE inhibitors, ARBs, or calcium channel blockers based on comorbidities. Next, let's look at lipid screening for hyperlipidemia. Guidelines vary by organization, but there's kind of a general consensus. So, all adults aged 40 through 75 should have a lipid panel every 5 years or more often if they're at risk. Patients with diabetes, obesity, or hypertension may need earlier screening. Statin therapy is recommended for an LDL greater than or equal to 190, and diabetics aged 40 through 75 with an LDL greater than 70 also need to be started on a statin therapy. Lastly, you can calculate the atherosclerotic cardiovascular disease or ASCVD, and if you have a risk of greater than 7.5%, then we should initiate statin therapy. All right, next, moving on to diabetes screening and heart health. The ADA and the USPSTF recommend that all adults 35 years and older should be screened every 3 years using a fasting glucose or a A1C. Screening earlier should be done if a patient is overweight, or if they have a family history, or if they're starting to show signs of metabolic syndrome. Why does this matter? Well, diabetes accelerates atherosclerosis, increasing the risk for MI, stroke, and peripheral artery disease. Encouraging patients to take action. So, as providers, we don't just diagnose, we educate and we empower our patients. Here are three key messages to give your patients. Number one, know your numbers. Encourage patients to track their blood pressure, cholesterol, blood sugar, and BMI. Number two, move more and eat smarter. We should aim to do at least 150 minutes a week of moderate exercise to reduce cardiovascular risk significantly. This can be anything. It doesn't have to be running on a treadmill. We can advise our patients to walk their dogs or play with their grandkids. A DASH diet and a Mediterranean diet also have proven benefits for heart health. Number three, stay on top of your appointments. So, routine checkups and screenings save lives. Help patients stay accountable and make sure that you give them notifications for their follow up appointments. All right. In almost every episode we have here on the Pro PA podcast that we look at the book med versus the street med. So I wouldn't be doing my job if I didn't tell you a little bit about this. So book med, we have clear guidelines that we need to screen early, treat aggressively, and follow protocols. Now, on the street, patients don't always listen, unfortunately. I'm a patient myself, and sometimes I can be a little bit stubborn, hard headed, or maybe I just can't find the time to do all of the things that my provider is recommending. So, things to think about when we are trying to encourage our patients are that one, they might not listen, two, they might not even have access to be able to do these things that we're recommending. And sometimes these patients might dismiss their heart health as an old person's problem, or, you know, that they might think that this heart problems start later on in life when in fact we're seeing that it's starting earlier and earlier. So, real world takeaway is small, realistic lifestyle changes can really go a long way for our patients. All right, now let's do some PANCE style questions to test our knowledge. We have a 55-year-old male who presents for an annual wellness visit. He has no known medical conditions, but his blood pressure today is 138 over 85. His BMI is 31, and his father had an MI at the age of 52. What is the next best step? Is it A, begin antihypertensive? Is it A, begin antihypertensive therapy? B, counsel on lifestyle changes and recheck in 3 to 6 months? C, prescribe a statin? Or D, order an echocardiogram? I'll give you a few seconds. If you answered B, lifestyle changes and blood pressure monitoring, you are correct. We want to do these steps initially before starting medications. Also, we want the patient to take home blood pressure readings over the next 2 to 3 months, 3 to 6 months until their next follow up so that you can see if the blood pressure reading is a one and done or if it's something that's happening consistently for them. Number two, a 48-year-old female with hypertension and obesity presents for a routine visit. Her LDL is 185 and her ASCVD risk is about 6%. What is the next best step in management? Is it A, start high intensity statin, B, lifestyle modification and repeat lipid panel in 6 months, C, start a moderate intensity statin, or D, no intervention is needed at this time? I'll give you a few seconds. If you said C, you are correct. So, patients with an LDL greater than or equal to 190 meet criteria for a moderate intensity statin therapy. These are things that probably shouldn't wait. I know we can get patients in sometimes they're like, oh, let me try to do diet, let me try to modify, let me try to lose weight, and then maybe we'll reassess at my next visit. Well, the thing about it is that we want to protect our patient's health as best we can. So, we can always prescribe the statin, have them start it with those lifestyle modifications that they are intending to do. And at the 6 month follow up, we can check them and see if things have changed. And we could always back them off of therapy once we started. It's not that when we prescribe a medication, it doesn't have to be a lifelong medication that we are prescribing. So that's just something to think about here. All right, well, that wraps up our Heart Health Awareness Month episode. Take this time to refresh your cardiovascular screening knowledge and encourage your patients to prioritize their heart health. You can listen to the Pro PA podcast on my YouTube channel, Professor G PAC, on Spotify, or on Apple Podcasts. We thank you for listening to this episode, and we hope that you'll follow and hit the notification bell so that you can be alerted whenever we have a new episode out. And remember, this is the Pro PA podcast, where future pros in medicine are made. I'll see you next time.